It's kind of a privilege, I think, to be asked to be into someone's personal experience like a birth. And each time is a new experience, and I think you kind of feed off the energy of the people around you in the room and the parents, and they're excited, and it makes me excited, and I try to make a special experience for them. My job is to kind of make sure that, listen to you and understand what you want, and try to accommodate and try to belay any fears and just guide you through the rough waters of anxiety or any issues that may occur. When a patient comes in to see me, and they're quite unsure whether they're going to come to this hospital or a different hospital or use me as a physician or someone else, I think a lot of times there's a lot of difficult questions, but I think almost instantly you either have a connection with that patient. Columbia Center obviously is probably, in our opinion, the nicest place to deliver a baby in Wisconsin, and anywhere I go on vacation I look at birthing centers too, and I think this is still hands down the nicest place as a physical facility. However, I think it's more than that. I mean, it's a nice place to be, but it also is a very nurturing place where the nurses are very good and nurturing. There's options for patients that might not be readily available at other places, and I think it's the whole patient-centered philosophy and kind of care of the newborn mom together that really make the Columbia Center special. In terms of obstetrics, I mean, it's such a vast area, and even going through, you can go into high-risk obstetrics, but we really do a whole array of fertility to common obstetrics, and we do, I would say, in most opinions, most high-risk obstetrics. So we don't really necessarily have any barrier in who we take care of. There's the obvious very sick patient that we work with our referral, which are maternal fetal medicine specialists. However, because we have such a good relationship with those physicians, we tend to manage those patients, which I think patients really appreciate. My favorite thing to probably take care of is people who have had complex obstetrical issues that may have had different surgeries or different interesting twists in their previous care, that I can then kind of move forward and guide them through the stress of what they had before and make them have a better experience this time. My favorite sports team is probably the Green Bay Packers, only because I grew up here in Wisconsin, and I had to watch the Packers lose for the majority of my adolescent life. And then I had a little surge with the Brett Favre years, and now I'm reveling in this last victory in the Super Bowl.